Welcome to the core objectives in gross anatomy. This is the third section of the upper limb module entitled The Facial Compartments of the Upper Limb, the Scapular region. My name is Carlos Andres Suarez-Quian. I am the creator of this video and will narrate it for you. As described previously, these objectives are based on the report written by McCanwell et al. In 2007 and published in the Journal of Anatomy. Let me read the objective that will be presented in this video and is shown in the next slide. Describe the facial compartments delimiting the major muscle groups of the upper limb. Explain the functional importance of those compartments and their content. In this first section, I will describe the muscles found in the scapular region that move the shoulder. The shoulder is the region of the upper limb attached to the trunk. Three bones make up the shoulder region: the scapula, the clavicle, and the proximal part of the humerus. For simplicity's sake, only scapular movements will be described in the next few images. However, when thinking of shoulder movement, envision the proximal humerus attached to the scapula as it moves when the scapula moves. When the glenoid cavity rotates superiorly, as when raising one's arm, this is known as upward rotation. When the glenoid cavity rotates inferiorly, in the reverse action of raising one's arm, this is known as downward rotation. When the upper border of the scapula is raised, as in shrugging your shoulders, this is known as elevation of the scapula. When the scapula is lowered, this is known as depression of the scapula. When the lateral border of the scapula moves laterally and anteriorly around the thoracic cage, this is known as protraction of the scapula. This action is generated when throwing a punch or pushing against a wall. When the medial border of the scapula moves medially and posteriorly around the thoracic cage, this is known as retraction of the scapula. Now let's look at the numerous muscles that bring about the 6 actions of the shoulder that we just described. We begin looking at the muscles that act on the scapula in the back region. The superficial fascia from the left side of the back was completely removed to demonstrate the superficial muscles. The trapezius extends from the back of the skull and the spines of the vertebrae to the scapula and clavicle. Its fibers are distributed into 3 main zones: the upper, the middle, and the lower fibers, and each will move the scapula in a different direction. The latissimus dorsi muscle takes its origin from a broad aponeurosis attaching to the lower vertebrae, sacrum, iliac crest, and lower ribs, and extends to the humerus, specifically to the intertubercular sulcus. Although the muscle is being described in this section, it does not actually move the scapula since it is not attached to it. The latissimus extends, adducts, and medially rotates the humerus. The deltoid muscle is the muscle that grants the shoulder its contour. It too has fibers arranged in 3 directions. At present, we only see the posterior fibers. These attach to the scapula and extend to the humerus. The posterior fibers of the deltoid help to extend the arms. The middle fibers are the major abductors of the arm. The muscles that we just observed, their innervation and their main action are listed in the table. If you wish, you can stop the video now and read this information. The trapezius muscle is innervated by the spinal accessory nerve that enters the muscle from its underside. It is accompanied by the superficial branch of the transverse cervical artery, a branch of the thoracocervical trunk that arises from the subclavian artery. The spinal accessory nerve and accompanying vessels enter the trapezius muscle from its underside. This was the reason the muscle was reflected to show you this neurovascular bundle. And here's a superficial branch of the transverse cervical artery. With the trapezius muscle reflected, it is now possible to observe the intermediate muscles of the back. These include the levator scapulae muscle, the rhomboid minor muscle, and the rhomboid major muscle. As its name implies, the levator scapula elevates the scapula. The rhomboids retract and elevate the scapula. The levator scapula and rhomboid muscles are innervated by the dorsal scapular nerve. The muscles need to be reflected to observe the nerve. The nerve is accompanied by the deep branch of the transverse cervical artery. Again, as a review, here's a table with the muscle names, their innervation, and their main actions. The deltoid muscle was reflected and the thick, deep fascia of the scapula was removed to better demonstrate the set of muscles that we will explore at this time. For orientation purposes, look at the spine of the scapula indicated in the image. The supraspinatus muscle is located above the spine of the scapula, whereas the infraspinatus muscle is located below the spine. The teres minor muscle is located just inferior to the infraspinatus muscle, and the teres major muscle just below that. The reason the teres minor and major muscle are called teres is that teres in Latin means round. Thus, the teres minor is a small round muscle and the teres major is a large round muscle. Also, note that the long head of the triceps brachii muscle can be found between the teres minor and major muscles. Again, as a review, here's a table with the muscle names, their innervation, and their main actions. The supraspinatus and infraspinatus muscles are innervated by the suprascapular nerve. The muscles need to be reflected from the scapula to observe the nerve. The nerve travels with the suprascapular artery, a branch of the thoracocervical trunk that arises from the subclavian artery. Here's the suprascapular artery above the ligament, and the suprascapular nerve below the ligament, and finally the suprascapular ligament. Note that the suprascapular artery travels above the suprascapular ligament, whereas the nerve is located below the ligament. The deltoid and teres minor muscles are innervated by the axillary nerve, located in the quadrangular space. The nerve travels with the posterior humeral circumflex artery. Here's the axillary nerve, posterior humeral circumflex artery, the branch of the axillary nerve to the teres minor muscle, and the quadrangular space from which the nerve and artery emerge. A scapular muscle that is hard to see is the subscapularis. It is located on the anterior surface of the scapula. To see this muscle, it is necessary to first dissect the pectoral region and the axilla. I will show these steps in later parts of the video, but to complete the list of muscles that form part of the scapular region, I've jumped ahead and show the subscapularis muscle after the content of the axilla, fat, axillary artery, and vein, and most of the brachial plexus cords was removed to expose the subscapularis muscle. I will discuss the brachial plexus and its terminal nerves in a later video. At this time, however, to demonstrate the innervation of the scapular muscles when presenting the muscles to you, I am taking the liberty of again jumping ahead and showing you the innervation of these muscles, knowing full well that this may confuse you at this time. Please bear with me. The posterior cord of the brachial plexus provides the innervation to the subscapularis, teres major, and latissimus dorsi muscles. Branches of the subscapular artery not shown, supply these areas. For orientation purposes, the latissimus dorsi muscle is labeled. This is the part of the latissimus that inserts into the humerus. The nerves of this region are also labeled. For example, the upper subscapular nerve that innervates the subscapularis muscle. The thoracodorsal nerve that innervates the latissimus dorsi is shown. And finally, the lower subscapular nerve that innervates the subscapularis and teres major muscles, the latter not shown in the image, is now labeled. Four of the muscles that we have discussed up to this point make up the important rotator cuff. These are the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. The glenohumeral joint is quite shallow. See the upper image. Shallow joint allows for enhanced mobility at the expense of stability. The tendons of the rotator cuff muscles, shown in the lower image, form a cuff around the head of the humerus, attached to it, and help to stabilize the joint. And once again, here's a summary of all the muscles that we have examined up to this point. We now move to the pectoral region that is located on the anterior chest wall. There are muscles of the pectoral region of the thorax that also help move the scapula and hence the shoulder. To see these muscles, other muscles of the thorax need to be reflected, as well as the mammary gland if you're looking at a female. Let's start. We start our exploration of the region by removing the skin and the superficial fascia. The superficial fascia can be prominent in this region. But after removing the superficial fascia, we begin to see important structures found in the area. For example, the deep fascia of the deltoid, the deep fascia of the pectoralis major muscle, and the cephalic vein in the deltopectoral triangle. If you're dissecting a female cadaver, the mammary gland will be in the way of exploring the muscles found in the pectoral region. The mammary gland needs to be removed. The mammary gland is found within the superficial fascia in the female. Suspensory ligaments of Cooper separate the gland into compartments. Breast tumors are also common. Some cadavers may have silicone implants due to breast reconstruction. Try and avoid cutting through the implants. If the silicone spills, it can make the dissection area very sticky. For orientation purposes, the skin overlying the breast is labeled. The fatty tissue of the breast is shown. Examples of suspensory ligaments of Cooper are indicated. Lactiferous ducts. And finally, an example of a tumor mass which was found in this particular breast. After reflecting the superficial fascia and the mammary gland in the female cadaver, the underlying deep fascia of the pectoralis major can be observed. Shown labeled is the clavicle-pectoral fascia, which represents the deep fascia of the pectoralis major muscle. The clavicle-pectoral fascia was removed, as was some of the fat from the axilla, to demonstrate the two distinct heads of the pectoralis major. The clavicular head of the pectoralis major muscle and the sternal head of the pectoralis major muscle. Also labeled is the deltoid muscle. The pectoralis major muscle has several functions, principles of which is flexion, adduction, and medial rotation of the arm at the glenohumeral joint. It does not work at the level of the scapula because it is not attached to it. The pectoralis major muscle needs to be reflected to demonstrate the pectoralis minor muscle that is located deep to it. The clavicle-pectoral fascia was also removed from the underside of the pectoralis major muscle. We can now see a muscle of the thorax that does attach to the scapula. The pectoralis minor muscle has some ability to protract the scapula. The last muscle in this region we need to consider is the serratus anterior muscle. It is best observed after reflecting the pectoralis minor muscle. The serratus anterior muscle is a major muscle used for protracting the scapula. Exiting the serratus anterior muscle along the midclavicular line will be numerous small nerves. These represent the anterior and lateral branches of the intercostal nerves. The T2 intercostal nerve is known as the intercostal brachial nerve, and it is of clinical importance. It is the anatomical basis for why referred pain from angina is felt running along the medial border of the arm. Let's now consider the innervation of the muscles of the pectoral region. The pectoralis major and minor muscles are innervated by the lateral and medial pectoral nerves, branches from the lateral and medial cords, respectively. The medial pectoral nerve pierces the pectoralis minor muscle and innervates both the pectoralis major and minor muscle. The lateral pectoral nerve only innervates the pectoralis major muscle. If their naming seems confusing at first, remember these nerves are named based from where they emerge from the lateral or medial cords, respectively, not where you see them entering the pectoralis major and minor muscles. The serratus anterior muscle is innervated by the long thoracic nerve, a branch from the roots of the brachial plexus. The blood supply of the pectoral region is mainly from the axillary artery, a continuation of the subclavian artery. The arteries change name once the subclavian artery crosses the distal border of the first rib. The branches of the axillary artery include the following: the superior thoracic artery, thoracoacromial artery, the lateral thoracic artery, and the subscapular artery. This cadaver illustrates an important variation. The lateral thoracic artery originates from the subscapular artery, not the axillary artery. Finally, once again, here's a table of the muscles that we just discussed. This now concludes the third video of the upper limb series.